You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. In studio, we have Dr. Kwansoo Lee. Dr. Lee, welcome to the program.
Hi, Randy. Thanks for having me.
Good. So for people that don't know your practice, like who's the typical dental implant patient that you see?
You know, I like to categorize them into two types of patients. There's one type of patients that has really just bad teeth, and their gums are hurting, they got bad breath, and they don't want dentures. They want something better than dentures. And we have another group of people who are denture wearers, and they've been wearing for many years, and they need something better.
So you say you don't need an implant for every tooth. Is that right, that you're replacing?
Yeah.
Like for a denture wearer, how many implants do you need?
So there are different options. You can go ahead and place 2 dental implants, and then give you snap-on denture teeth that can come in and out.
You do a lot of those, right?
We do a lot of those, yep.
How do people like them?
It's life-changing for patients who's been wearing poor-fitting dentures for many, many years. They can finally go ahead and eat food that they weren't able to eat before. Okay. Right.
Good. Now, what about the next level? Because you say you can give them a brand new set of teeth that don't come out.
Right.
How many implants does it require for that?
So minimum, it requires 4 dental implants, but if there's room for more, I place 5th or 6th implant to just make it more secure.
Okay.
Yeah.
Now, how soon, of course, if everything works out right, they're healthy, things like that, or they might be in their 70s.
Right.
How soon can they eat after the final procedure?
If everything goes as planned, we place the implants and we give them the temporary bridge. They can go and eat that same day after they wake up from anesthesia.
Is that right? Now, what about pain?
Pain, we do prescribe painkillers, but surprisingly, most patients do very well. They may need it that night and the following day, but afterwards they
like you give them what, like ibuprofen or Motrin? What do you guys give them for the pain at home?
Yeah. So they can take a combination of ibuprofen, Tylenol, combine those, then that works as a great painkiller.
And most of these people that come in, right? Okay, so the denture wearer comes in. Yeah. They can come in one afternoon on the day of the procedure and walk out with upper and lower teeth that don't come out.
That's correct.
Is that true? Have you done that before?
Yes, we've done that before.
Okay.
Yeah.
So that's a common thing in your practice.
Yes. It is common.
Okay, good. You brought photos. What are we looking at over here? Yeah. These are some of these patients.
All right, so we got Ed here. He's a retired military veteran. And so he came in, he's got very severe bone loss. His teeth are loose and essentially it's falling out of his mouth. And so then we made diagnosis. We took his 3D x-ray, checked out his bone level. Fortunately, he had enough bone left over to go ahead and be able to the implants for him, so I was able to present the option, and he agreed to the treatment. So
this is a guy that needs a full mouth of extractions.
Yes, full mouth of extractions. You're right.
And not a denture.
Not a denture. No.
Give him brand new teeth,
brand new set of teeth,
supported by implants.
Exactly. So he showed up one morning. He was again sedated with the pills, and after 4 hours, he was able to walk away with a brand new set of teeth. And I called him that night, and he was doing great. He said, he barely felt any pain. He took some Advil, and he went home and had a regular meal.
So when they're all healed up, they could chew whatever they want?
Yes, they can chew whatever they want.
What about like eating a carrot with your front teeth? Or do you have to be careful?
Oh no, they can go and eat the carrots with front teeth.
So whatever they want.
Yeah, exactly.
So what do they like the most? The way it looks, or what they can eat?
For him, he just wanted to able to eat normal again and without pain. But he told me that he loves his smile. He said he's smiling more. He goes and his coworkers told him that at work that they noticed that he's talking more and smiling more at work. He's more excited.
Now, when it's all done, you said that you see changes in personality, like when they even come visit your practice. What do you describe that to me?
And so, when you are not confident with smile, then you're kind of shy. You don't want to. You avoid going to social events like parties or weddings. But But once patients have this transformational experience, they can go ahead and they can talk normal, and they can smile normal, and be who they are again, and it's life changing. Oh, let me show you the next patient.
All right.
This is Lorna.
Okay. Wow. So she walked around like that, or she had like a flipper?
She had a partial that she's been wearing. Right.
Okay.
Same thing as flipper.
Removable?
Right? Removable. It comes on and off, and she showed me, and she wasn't happy with it, and she was something better.
Okay.
And so then I gave her the options. You can go to full plate denture, but I knew she wanted something better because she wasn't happy to removable. So then we went over the options for dental implants with the fixed teeth.
Yeah.
And she's like, Dr. Lee, that's it. I'm going with that.
Okay.
And it was a very quick decision, and she decided to move forward. And so this is how she looks like right now.
And you do this in one day?
And we did one day. Yeah. One afternoon, she walked out just looking like that. And she was ecstatic. She actually moved away from Washington. She's like, I'm out of this rainy weather. I'm moving to somewhere it's nice and warm. She moved down to Arizona, and I still keep in touch with her. She's having a great time down there.
You still keep in touch with her?
Yeah, she's such a nice lady, and I just want to follow up with her, see how she's doing. And she said she's out of pain. She can eat whatever she wants. She's living a great social life, and she's living a great life.
So their self-esteem, their confidence must go way up.
It goes way up.
Right?
Yes. I mean, just look at her eyes. You can see the difference from before.
Yeah.
Now
with her, are most of these people getting like some sort of a pill or IV sedation?
Yeah, for her, I mean, we do two types of sedations. We do with the oral, and we do IV. In her case, we went with oral, and she was given pills the night before to help her sleep, and she came an hour early to her appointment, and then she was given pills, and she was comfortable within an hour. And then
so you monitor what?
We monitor her vital signs, heart rate, oxygen level.
So this doesn't really hurt during the procedure.
No, it doesn't.
Right? So they can't. They're numb.
Yeah,
they can't feel it.
Yeah. On top of that, sedation, they're given local anesthetic, so they're comfortable. Let me show you this guy. We have Michael here.
Okay. Wow.
Yeah, he's in early 20s, and he's going to college. He told me that he has to give presentations sometimes in front of the class.
Yeah. Oh boy.
Yeah, and he came in like this. I've never seen him before, and so he wasn't wearing no partial or nothing like that, and he wanted.
Do you get excited, by the way? When you talk to a guy like this, you're going, boy, this is going to be good.
Yeah. So I can already see the what he's gonna look like once it's all finished. And so it got me very excited. I say, Michael, you're a young guy. You got a whole life in front of you. We can do something dramatic to improve your life, and so that you can have your smile back, and you can eat better, and you can get your confidence back. And so then we decide, in his case, we went with snap-on denture option. We placed the implants and
so like snap-in teeth.
Snap-in teeth, exactly.
You do a lot of those.
We do. We've done hundreds of cases.
So much better than a loose-fitting denture, obviously.
100 times better, if not 1,000.
Okay. Look at this guy. He looks happy.
Yeah.
In this shot. So I guess they have to get used to smiling again, right?
Yes.
Like he's smiling, like obviously smiling.
Right.
But if you've gone your whole life without smiling, you learn to do it again.
Right.
Is that what happens?
Yes. So he said now I still see him. He comes in for his follow-up visits, and I ask him, how are you doing? And he said, Doc, I feel I'm getting better grades at school. I can go and talk to my friends without being embarrassed. I have more confidence in myself, and I feel like after college I can go ahead and apply to a good job and get a job, right? Can you imagine going interviews looking like having the teeth that he's had originally? I can. Because
people are judged. We talked about in the movies.
Yes.
If you want to make somebody look bad, you give them bad teeth. If you want to make them look poor, you give them bad teeth. The people, because this affects everybody, right? Like gum disease.
Oh,
Not
yes.
everybody, but I mean, it affects a lot of people.
It
doesn't matter how much money you make.
A large population of people, yes. No, there's a big genetic factor to it. So it doesn't matter what your background is. You're sometimes you're predisposed to the condition, and so you have to deal with it. Some of these people,
with horrible teeth.
Yes.
Like these people, you say brush and floss all the time, but it's too late. Like the gum disease is taken over.
Yes.
There's some truth to that?
There is some truth to that. Again, there's a huge genetic factor to it, and so there are patients who've done everything they can possibly do and getting the treatments they needed to go ahead and hold on to their teeth, but ultimately sometimes it just doesn't work
Okay.
and they're not able to keep their teeth.
Now, when they see their face, like a guy, especially a guy like this, when they see their teeth for the first time,
Yeah.
their face in the mirror for the first time, do they ever get choked up? And do you guys ever get choked up?
Oh yes, once they get their teeth and they look at themselves in the mirror, they cannot believe that's who that person is. And so
Is that right?
Yeah.
Are there really that many people that don't like their teeth?
Surprisingly, Randy, I've come across dozens and dozens of patients myself that just are not happy with their own teeth.
Because people don't like going to the dentist, right? Do you ever hear that?
I never heard that, Randy.
No,
I'm
they
kidding.
say doctor.
Yeah, I hear it every day.
Offense. Like, what do they say?
I hear every day. And I told them I'm not offended by that. It's not the most pleasant experience. Is they come because they have to, but I try to do our best to go and make sure they have the most comfortable experience they can possibly get coming to see us.
So if a patient comes in, okay, so there's two groups: the people that have the bleeding gums, the bad breath, the loose teeth.
Yeah.
You cannot save their teeth. Dentures is a major option for them. And then the other group are the denture wearers. So when they go to your office, like, what are their actual options? What do you tell them that they can do?
So I gave them mainly 3 different options.
Okay.
First option is we can go and place 2 dental implants, and then
And they get a full set of teeth.
they get a full set of teeth that snaps on and off from the implants. They got little connectors beneath the denture that snaps on top of the implants. Another option we can give is instead of going 2 implants, we can go to 4 implants. It's a lot more stable. It's like a chair. It's got 4 legs, so it's a lot more stable. And it's
Also snap in, snap out?
Yes, it's also snap in and snap out. But the better option is placing the implants and giving them a fixed teeth that don't come out, and it's almost like getting your old teeth back, right?
Okay.
So these are
and you can eat whatever you want.
You can eat whatever you want. Yeah.
So what do they like more? What they could eat, or how it looks?
It's both. Sometimes patients come in and they want just you have to eat, but then once they get their teeth, they say, you know what, I like how my teeth look, and they can go and smile more. And
now for the upper, like a denture wear, if you're wearing a denture, that upper has like the roof covered, so it's suction. So you're okay with the upper, with the denture?
No, once patients get their first set of denture, they hate it because they can taste their food well. It covers covers their palate. Your palate actually has taste buds in there.
Okay.
And once that's covered, it changes your perception of food.
So now when you give them implants, it's just like it's like a full set of teeth attached to how many implants?
Minimum is 4 implants.
Okay.
But then,
Is that what you do, like 4?
Yeah, 4.
And then they're locked in. They don't come out.
They don't come
out.
out.
Roof of the mouth is not covered.
Yes. It's a horseshoe shape, so they.
What do the denture wearers say?
They say I can taste the food so much better.
Okay.
And it frees my tongue.
How old can you be to do this?
I'll be honest with you, Randy. You can do this at any age. I've placed implants on patients who are more than 90 years old.
90 years old?
Yes. She had a poor fitting lower denture, and we were able to give her snap-on teeth, and she was ecstatic. She can't go.
90-year-old?
90-year-old.
Can get teeth that just lock in there.
It just locks in, and
are they more likely to fall out when you're 90 years old?
No, they're not. They're just as secure as a 30-year-old who needed the procedure. Let me show you another patient.
All right.
This is Bill. He's wearing actually a full plate denture that he's had it for many years. You can look at him. He's got broken teeth on his denture, and he's been going on for years with those teeth. And so, can you imagine, kind of life he's been having for those years?
Are there a lot of people like this? Like they have dentures that are broken down and they're still wearing them?
Oh yeah, there's thousands, and they get lost in the system because once you get your dentures, you say, hey, I don't have any teeth. Why do I have to go to the dentist? And in this case, he finally showed up because he's got broken teeth, and he thought he wanted different options on how to repair his broken teeth on his denture, and so then I had the opportunity to go and introduce him about better options with dental implants.
So it's like you say, like the third set of teeth.
Oh, exactly, third set of teeth. For him, it would be a fourth set of teeth.
Okay.
Yeah.
Okay. Oh, that's right. He already had his
Yeah,
third set
that's
with the
his
denture.
third set of teeth.
Okay.
And so
what's it like for him? So you go in, so you
Yeah,
tell him,
when-
okay, so I can give you teeth that snap in, snap out?
Yes. So I showed him, I brought him the model. He's like, hey, Bill, go and try this out. This is what it's going to be, I had the model, and there's denture teeth with the connectors, and he snapped in. He's like, Dr. Lee, is this how it's going to go? He's like, yeah. He's like, hey, I'm sold. I want this. And so then we were able to go ahead and place implants on the upper and the lower. And
Is that the after right there?
oh yeah, and just look at his smile.
Looks good.
Oh yeah, and so it just improved his life dramatically. And he said, I can eat whatever I want. And cool thing about the again, as I mentioned before, with the upper teeth, conventional denture covers the full palate, but with the snap-on teeth, we hollowed out the palate. It's a horseshoe shape, and so then it frees the palate. He can taste the food so much better. He gets the he can locate where the food is better. He's got more room for the tongue, and he can enjoy his life so much more than he did before. And so,
Now these people, what, they just come in like every 6 months, like regular teeth, and get them cleaned?
yes, so it does require a little more maintenance than having fixed teeth, because actually it's a safe mechanism. Under the denture, the connectors, the nylon parts do wear down, and so then every 6 months to a year, it needs to be swapped out.
So for the snap-in, snap-out teeth, you maintain them?
Yes, you
And
do
clean
maintain
them
and
at the
clean them at
dentist.
the same time, and
Okay.
that's why they need to come in every 6 months to a year to get those maintained.
Okay, now what about now with pain? Like you say, you now offer IV sedation, you give them a pill.
Yeah.
But pain is the big fear, right? They don't want to do this because of that.
Yes, that's
But it's not something you hear as a complaint that often.
yes, because they don't come to the dentist if you have such a high fear of pain, and so I just want.
That's your challenge, getting them in.
It's definitely a big challenge getting them in. That's why even though we offer different sedations with the laughing gas and pills with oral sedation, I decided to go in and get trained on IV sedation. It took a lot of time and effort to get it done, but I'm IV certified, so I can go ahead and start the IV drop, and it's a conscious sedation. So then all your breathing, we're not affecting your breathing, we're not affecting your reflexes, and we're able to make you comfortable within minutes. And so then, and the coolest part of that is that it has an amnesic effect, so you won't remember. You wake up.
You forget a little bit of it.
Oh, exactly, Randy. You wake up and it's all done, and you go home, and it's very easy process.
So this is changing dentistry altogether.
Oh yeah, for sure. Yes.
Like because dentistry, and we've talked about this on the phone.
Yeah.
There's like a patchwork. You fix this and patch up that.
Yeah.
And now implants come along. You get a tooth back.
Yes, you got a tooth back,
And they're permanent.
It's permanent, and now the materials are getting better. These materials that are just very durable, and they don't chip or break. You can use a hammer and smash it on A1 chip or
It's like
break.
zirconia, right? They're made out of zirconia.
Yes, it's all ceramic. It's not metallic. It's all ceramic material, but it's made out of zirconia, like you just said, and they stay polished. They don't stain. And
They don't stain.
They don't stain.
Red wine, you could drink it.
Oh yeah, as much as you want. Yeah, just make sure you do it at night.
Well, that's a bonus right there. So they
Yeah.
really don't stain. They just stay, and you choose what color white, like how bright white. Like an older person doesn't want super bright teeth,
No,
right?
they don't. You're right. They want natural white. They don't want it dark, obviously.
How much say-so does the patient have in what it's going to look like?
Oh, they have a lot of things. So, when patients get fixed teeth, they have 4 months to try on the temporary teeth, and so if they don't like something, they can go ahead and change it. And we'll also do a try-in with that final teeth, where teeth are still in wax. And so if they don't like something, we can, we take the feedbacks and we
So they actually get to
lab
wear
tech.
teeth that they could look in the mirror at and say,
Yeah.
I like these, I don't like these.
Yeah.
And then you make the finals.
Yes, exactly. And so then, when they come in for a try-in, I always ask significant other to come in, and so that we have 6 sets of eyes to go ahead and make sure they're happy with how the final teeth is going to look like. Let me show you this guy,
Okay.
Randy. We have Steve here. He's a retired Army veteran. He came in literally complaining that his teeth are falling out of his mouth. He has very severe gum disease, bleeding gums, and he's got discolored teeth in the front. And when I told him to smile for the initial photo for the records, you can see that he couldn't confidently smile and show all his teeth. And so again, I gave him presented different options. And
So this guy, you could not save those teeth. You had to extract all of them.
oh, unfortunately, yes, that's correct. The disease process was too severe that it was irreversible. They could not be saved. So he didn't want a denture. So we gave him 4 implants, supported teeth, and it's screwed in.
Okay.
And it's permanent. They don't come off and on. And
Let's take a look at that.
Yeah. This is what it looks like now. You can see the dramatic difference when I told him to smile.
So with this particular guy, so now he has teeth that don't come in and out. He could eat, and we've talked about this, but like biting an apple, like with his front teeth, or corn on the cob.
Yeah. Yes.
They can eat, and there's no restrictions?
There's no restrictions on what he can eat. I mean, I do tell patients, if you like to chew eyes, please try to avoid those because they can go ahead and...
But that's even with regular
that's
teeth,
even
right?
regular teeth,
You don't
exactly.
want to eat ice.
But it's just all the everyday food that you can eat with normal teeth, you can do the same thing with these teeth. There's no limitations.
What about a single tooth? Like if you're just missing one tooth? Do people... Well, I mean, is this better than a bridge?
Oh, yes, for sure. Because in order to stand, before the dental implants came along, in order to go and replace a single tooth, you have to go and shave adjacent teeth down to tiny stumps so you can go and place a bridge. And when bridge maybe lasts, 8 to 10 years, you it fails, it becomes catastrophic. So you're often losing 2 or 3 or more teeth. And so when you see people missing a whole quadrant of teeth, 9 out of 10 times it's because they had a bridge.
Okay.
Because now with dental implants, I always try to tell the patients it might cost a little bit initially, but over long term you end up saving money because you're able to go ahead and save more teeth that way, and you can floss better. You can floss better between the teeth. You can chew better. It's easier to maintain, and you can clean better. So, if it's done right, it lasts a lifetime.
Now, insurance, and we should mention Medicare, Medicaid does not cover this, but you'll work with some, because maximum payout for insurance is not much, like $1,500, $2,000 a year at the most. You'll work with some of that?
Oh yes. The insurance benefits hasn't gone up in 30 years. 30 years ago, it's
Max payout was about
$1,500, and we're here in 2019, and it's still about $1,500.
Wow.
It's a very sad situation.
But are people financing this? I mean, aren't you like hooked up with lenders that do dental procedures?
Yes, we work with a couple institutions that help you go and make it more affordable, and so that you can go and make payments on it, so that you can go and get the procedure that you need.
Okay, good. Yeah. And now, have you ever done any dental implants on a family member yet?
I've done it on father-in-law.
Is that right?
Yes. He came in, and to be honest with you, I haven't paid attention because he had very lower lip, and I didn't know he was wearing dentures for about 10 years. And then he came. He's from Japan, and he came and visited me, and then he finally mentioned that he's got this dentures that he's just been putting up with for years. And so then he came in, and
like, what'd you tell him? Like, when you find out your father-in-law is wearing a denture, like, what are you thinking? Like, are you immediately thinking, oh my goodness?
Oh my! I was like, I wish he would have told me earlier, and so that I could have, give him something better. But I
so what'd you
just
tell
didn't
him?
know.
Like, what'd you tell him?
And so I was like, come on, let's go ahead and do this right now. And so we go ahead and diagnosed and treatment plan, and he still had good amount of bone left, so we went and placed 4 implants on top and 4 implants on the bottom. And just because he had to go back to Japan, so we converted his old dentures to snap-on teeth, so he can go ahead and start using it right away.
So upper and lower, snap-on. And what does he say when it's all done?
Oh, now he said he really likes eating. He enjoys eating, and so he can go ahead and eat as much sushi as he wants without having to worry about, teeth hurting.
How old is he?
He's about 76 right now.
76 years old. So again, that's not too old at all.
No, it's not. No.
People that smile showing their teeth,
Yeah.
it's like people treat them differently. It's like in our society, charisma is attached to smiling and talking.
Right.
Right? And there's so many people that don't smile because they hate their teeth. And we talked about this. It's not for everybody, but if you don't like your teeth, if you don't like your denture, get a new set of teeth.
Yeah.
Is that how you feel? I don't want to put words in your mouth here, but is that how you feel?
Yeah. You just gotta know your options, right? So,
Okay.
If you're not happy with how your teeth, you just got one life to live. So why not go and figure out what your options are and see if it's, you can make the changes that so that you can go and live the life that you deserve and you want to live. And so.
Okay. Because you do dentures in your practice, right?
Yeah, we do. We
You
do
make
dentures.
dentures.
We make dentures.
Is your goal always to kind of graduate them into like a snap-in,
Yes,
snap
but
out?
then my job is to give you what's on the menu, what's available in the and again, it's up to the patients to decide. But
So everybody gets the three options.
They do
which is a denture, snap-in, snap-out, or fixed teeth
and
that
fixed
don't come
teeth.
out.
Exactly. Yes.
Okay.
I'm very clear from the start on what the options are, and it's ultimately their call. But then I do want to. They need to be educated on the options and all the ramifications that can come from their choices. So
Now, we're out of time here, but final message. Somebody's watching this.
yeah.
They've heard what you had to say. Maybe they're wearing a denture, or they have the bleeding gums, the bad breath, the loose teeth, they have gum disease, and they don't know what their options are, but they're afraid. What do you say to them? Maybe they've heard what you had to say, but they're still afraid. You just invite them in?
Just come on in and get a free consultation. We'll go and take your 3D X-ray.
Free X-ray too? That's included?
Yeah, free
Okay.
3D X-ray. And so that you just want to know your options. First option, let us give you a better looking denture.
Like a cosmetic denture.
Yeah,
Okay.
exactly. And then second option, again, as discussed before, about you can go and snap on teeth. That comes on and off, and the best option I hope that you go with is the fixed teeth that doesn't come out.
Okay. Good. And you do it all right there
We
under
do
one
right
roof?
there, yeah,
You
under
don't really
one
have to
roof.
send them out?
No, we don't. No.
Okay. And I want to thank you for coming on the show.
Yeah.
Good stuff. So if people have more questions, they just go to your website,
Yes.
make an appointment there?
Yes, they can go and check my website.
Do you do the consults?
Yes, I do.
So they get
I'm
to meet
there.
you?
Yep. Every consult, I'm there.
Okay, good. I want to thank you for coming on the show. Good
Yeah.
stuff.
Thank you, Randy.
All right. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.